Welcome to Medical Marijuana and Wellness. Today's topic is treating neuropathy with medical marijuana. So let's take a look at neuropathy and what is it. Neuropathy is where the myelin sheet that protects your nerves is actually damaged or destroyed. Now, this can happen in a number of different ways, but the interesting part is that the protective coating on the nerves are no longer there. In other words, it's exposing those nerves so that what happens is that the nerve cell, the neuron, which generates the signals that are needed, are scrambled. And how does this result? Well, it results in numbness, heat, cold, tingling, a number of different sensations that, quite frankly, are very uncomfortable. When you look at the different types of neuropathy, we know that neuropathy affects 6 parts of your body: your eyes, your bladder, digestive system, heart, blood vessels, sex organs, and sweat glands. And this manifests itself as peripheral neuropathy, damaging your nerves in your toes and feet; proximal, which means it handles part of your body, for example, the lower part of your body or one side of your body or the other or leg; autonomic, which is where it affects the processes of your bodies like digestion, and also your focal and cranial neuropathy, which leads to disturbances in your vision. So is there medical research into cannabis helping with neuropathic pain? And the answer is yes. The Canadian Medical Association, in their journal, chronicled in PubMed, which is the database that your doctor will use to look up research on various medical conditions, found that cannabis can moderate or relieve in patients' neuropathic pain. They also found that it's more pronounced in the central nervous system as opposed to the periphery of our body. Now, looking at the foundation for peripheral neuropathy, they took a look at a number of clinical trials that looked at different routes of administration, meaning different ways that people took cannabis, whether that's sublingual, oral, smoking, or vaporized. And what they found out that all of them demonstrated benefits to be able to help with neuropathy. So what makes cannabis such a big deal? Well, we all know that we have a nervous system. We know that if we hurt our finger, our toe, our knee, a signal is sent up to our brain that says, Houston, we have a problem. What's interesting is when they started studying cannabis, they found that our body has what they call the cannabinoid system. This is a system that helps our body basically process and manage pain, anxiety, memory, appetite, inflammation, and our immune system. It tries to help your body stay in what they call homeostasis, and homeostasis is your body in balance. So when Houston says we have a problem, what do they do? What does it do? It hands it to the endocannabinoid system. Why cannabis? Well, cannabis is a whole medicine cabinet. We know it has over 450 medical properties, and if you look over here to the right, you'll see some of the studies. These are each medical research studies that have been done on cannabis and the various parts of your body. We know there's over 120 cannabinoids, of which there's a few of them chronicled over here, and we know it has over 100 terpenes. So there's a lot of components to the cannabis plant that when they all work together, it creates what they call the entourage effect. In other words, they're more effective when they work together than individually. And we'll talk a little bit about that later on in the presentation. Your body naturally produces endocannabinoids. This is how it tries to keep your body in homeostasis. Now, what we found is that, and what they found in medical research, is that cannabis produces what they call phytocannabinoids. Phytocannabinoids exactly mimic the endocannabinoids in your body. And what they mean by that is they provide the same binding to the endocannabinoids receptors to help your body be able to stay in homeostasis. Now, why do you want to do that? Well, I, for example, am a senior citizen, and I don't produce endocannabinoids as quickly or as fast and as much as I used to. So by supplementing it with phytocannabinoids, I'm giving my body the resources it needs to be able to manage itself and be able to keep me in homeostasis. This was an important discovery about medical cannabis. Now, let's talk about a couple of the well-known cannabinoids, THC and CBD. THC is found in cannabis. It's interesting that hemp is defined to be a product or a plant that has 0.3% or less of THC in it. And so THC is mainly found in marijuana itself, and it can be psychoactive. And the reason it's psychoactive is because it targets the CB1 receptors in the brain and central nervous system. It is extremely effective to treat a number of conditions, and we'll talk about that in just a moment. CBD is also found in cannabis. It's also found in hemp. And again, it's non-psychoactive, primarily because it targets receptors that are in your peripheral organs and in your immune system. Now, THC is very, very important. And that's because it is also working with the CB1 and CB2 receptors, but it also blocks a lot of the pain signals. This is where you get a lot of the pain relief when you use it with neuropathy. CBD is important to address neuropathy because it has two interesting properties. The first is that it is an anti-inflammatory, and what that means is it reduces the amount of inflammation in your body, and by reducing the amount of inflammation, what that does is that reduces the amount of pain. That helps quite a bit. Now, the other property that CBD has is it helps to block or mitigate the effects that you get from THC. So if you're worried about getting high, or if you do get high from the product that you're taking, by increasing the amount of CBD that you're taking, really will mitigate, reduce the amount of high that you have, and be able to let you control the effects of the medical cannabis that you're using. Both of these products together, THC and CBD, are very important, but CBD especially has some interesting properties in that it has what they call a neuroprotective agent. And what that means is that it normalizes or puts the sheath back into what they call homeostasis, or back into balance. And that's really, really important to help relieve both not only the inflammation, but the pain from neuropathy. CBD also has the property that it affects a number of other receptors besides the CB1 receptor, which is your immune system and peripheral organ, and your CB2 receptor, which is managing inflammation, as well as the peripheral nervous system. It also will address your serotonin receptors. What that means, it helps with your blood flow and your breathing and your digestive system. It helps with your circulation and inflammation. It helps with the pain that's in your body, and also helps with your blood pressure. So CBD affects as, in essence, a super vitamin, or something that really can help with your body. And again, working with THC, the 1 and 1 is 3, it provides a very effective medicine in addressing neuropathy. Now, the key to using medical cannabis to address neuropathy is to pay attention to the terpene profile of the products that you're looking at using. Terpenes give the medical efficacy to cannabis. This is what brings out the medical properties. And if you're looking for relief from neuropathy, you want to pay attention to products or terpenes that address inflammation and also pain. Caryophyllene, pinene, myrcene, and limonene are all products that you'd like to have in the product that you're looking at using to address neuropathy and provide the relief that you're looking for. Now, where do you find these? Well, you'll find them in what they call cultivars. And what is a cultivar? A cultivar is a strain mixed with a terpene that has a particular targeted medical effect. And in this particular case, all of these strains that you see here, all these cultivars, that you see here, the Granddaddy Purples, the Sour Diesels, all the way down to the White Widows, all have an interesting terpene profile that we're looking for, which are the myrcenes, pinenes, caryophyllines, and the limonene. Now, you'll see things that say they're indicas or sativa. Indica means it's relaxing. They say it's in the couch. Sativas are more energetic, and hybrids are a combination of the two. But when you're taking a look at the products that you want to use, talk to the person behind the counter, get a certificate of analysis, and make sure that the terpenes that we're looking for are in the particular product to provide the relief that you're looking for. Now, the question is, how do you take medical cannabis? Well, there's a number of different ways, and unlike pharma drugs, you can take it both as a pill, so you can take it as a capsule, or a famous edible, which are your gummies, your chocolates, your brownies, that type of thing. But pay attention when you're looking at using capsules or edibles, because they may take 30 minutes to 2 hours to work, and they may work for 4 to 10 hours. But in many cases, people will take the product. I'll take an edible. They'll take a piece of a brownie. It doesn't work after an hour, so they'll take more. And what they'll find out after 2 hours is it starts to kick in, and you may have been taking too much. And this is where a lot of the negative effects come from using cannabis. Be very patient when you're using oral products, which are capsules and edibles, because they can take a long time to have what they call a longer onset. Most people use what they call sublinguals. Sublingual products are products that you put eyedroppers that you put under your tongue of medical cannabis. What it does is it helps your mouth absorb into your blood vessels the cannabis, and it goes to work fairly effectively. In 15 to 20 minutes, they start working, and it will last for between 4 to 6 hours. And this applies to both sublingual drops as well as any sprays that you might see in your dispensaries. One of the most effective ways to address neuropathy is through topicals. Topical is where you're applying something to the skin, and what it does is it works very quickly. In fact, it works almost immediately and can work between 1 to 2 hours. Now, there's also transdermals and some transdermal patches that are on the market. They'll work between 10 minutes to an hour, and some of the transdermal patches will last as many as 72 hours. Topicals are very effective to address pain and also to address inflammation. I use it quite a bit, and I really like them. But again, they have a shorter span of duration, 1 to 2 hours, but they work very, very effectively. The last but not least is inhalation. This is where you're looking at using flower or concentrates or a vaporizer pen. Now, pay attention to this, because in many cases, people will say, well, gee, I'll just light a joint and it'll work. And here's the problem with lighting a joint. The terpenes that we were talking about earlier are very sensitive to temperature. If you take that 500-degree flame and put it up to that joint or that blunt, you'll burn off half of the cannabinoids, all the terpenes, and all the flavonoids. You reduce the medical efficacy of that particular product or that particular joint down about 40 to 50%. That's the bad news. The good news is it still can be effective. So in many cases, flower is a particular option, and it'll last 2 to 6 hours. But I prefer to take a look at what they call concentrates. And concentrates are where they take the flower and they put it in some sort of a form, whether that's called a shatter or a rosin or a resin. And by being able to do that, they maintain and they keep the terpenes in the product. So you still get the inhalation process, works immediately, but they're very, very effective. In fact, they'll work almost faster than a flower product, or they'll work have a longer duration than a flower product in many cases because of the fact they have that terpene profile. Inhalation or vape pens are the same way. These are in concentrates. You actually have a pen you load up. In the case of vape pens, they come preloaded and they're ready to go. Again, ask your person behind the counter what the terpene profile is of the particular inhalation product that you're using. And inhalation is very effective. Now, people ask the question, is it bad for your lungs? There are no carcinogens that are in a cannabis product, but anything that you put into your lungs, you always have to be very careful. Much like pharma products where they have inhalers that really help the lungs, cannabis can do the same thing. But if your lungs are sensitive, talk to your medical marijuana doctor, talk to your doctor, and talk to the dispensary to get yourself a product that won't necessarily be as harsh on your lungs. And I think the best thing to do is probably just stay away from inhalation altogether and use the sublinguals, the orals, and the topicals as a way of being able to help you. So what's the bottom line? The bottom line is by using medical cannabis for neuropathy, it's safe. No one has ever died from using medical cannabis, either recreationally or medically, and you can't overdose by using medical cannabis. More importantly, there's medical research showing that cannabis addresses neuropathy, and you are in control, meaning that you control what you take, when you take it. And for example, as we mentioned with the CBD and the THC, if you start getting unexpectedly high, you can increase the amount of CBD that you're taking to be able to control the high or the negative effects from medical cannabis. You're not going to get addicted. And also, as we mentioned earlier, by talking about the routes of administration, you don't have to smoke it. There are routes of administration like sublingual drops, orals, and topicals that can really help you. Bottom line is all of them working together give you what they call the entourage effect. They work together to provide an effective product to address neuropathy. Thank you very much for joining us for this medical marijuana and wellness video. Please follow us on our social media, Marijuana Aware, on our YouTube channel for this video and previous videos that we've done about medical conditions that medical marijuana addresses. And naturally go to our webpage, Marijuana Aware, for future events, both webinars and seminars, as well as check us out on our Facebook page. Thank you very much for joining us.